Morning. How's it going? Said it. We're talking healthcare this morning. Big weekend. Guys, yes, it is Valentine's Day on Saturday. I'm sorry to say it, but poor Friendy didn't know. We had to remind him. He's going to be so mad at me for calling him out. But it's more important that you know that Sunday is the last day that you can sign up for healthcare. So this morning, Senator Joe Laurie joins me this morning to talk about the importance of signing up. We have another special guest with us as well, Chris Johnson. He's the Senior VP with Laurie Consulting. Now, you guys probably recognize these fellas here. They were on with us about 2 weeks ago now, talking about the importance of signing up. How have things been going so far?
It's been crazy. I mean, it really has. You know, what we're seeing around the country, and particularly here in South Carolina, is a surge in enrollment. We're seeing a lot more telephonic enrollment. People will call our office. We've got agents pretty much working around the clock. Of course, we're welcome for them to come in and meet with us in person. We're right off of Forest Drive. But a lot of people, because of this Sunday night deadline, will call. It takes about 15 to 20 minutes. We can get them enrolled. Predictions we see in South Carolina, based on insurance carriers we talk to, friends throughout the industry, we could have upwards of 200,000 South Carolinians participating in the Affordable Care Act, all enrolled by the end of Sunday night.
Wow. So you guys have been talking to a lot of people. Good to know that you said 15, 20 minutes, because some of you might be out there this morning going, I have a lot of questions, but I don't have the time. 15, 20 minutes. That's really good to know. So what kind of questions are you guys getting, for the most part? What's the most common question?
Well, the most common question right now is how to avoid the penalty. And that's what's top of mind for a lot of folks right now at this point, because the penalty, if you do not sign up for health insurance by midnight on Sunday, is $325 for one person or 2% of your income, whichever is higher. And so it's been amazing, though. A lot of folks had no idea what their options were, and to be able to help people out, it's been truly a blessing.
So now, what are some of the typical payments the average person could expect? Do you have some examples of real-life folks that you've been talking to?
Sure. So some of the payments that we've seen have been averaging with the subsidies, because that's really what helps folks out. With the Affordable Care Act, what makes it affordable are those subsidies. It's based on your income and your household size, but we've seen people with premiums as low as $0, $10, upwards of $100 or more. And again, it's all based on your household income and your household size.
And age too. But it really is, Chris mentioned the word blessing. I think that's the best way to describe it. The fact that, it's not an easy process to navigate on your own. Our service is free. People call us, and we're helping people getting enrolled in insurance, many of them for the first time in 10 years. And they can go to the doctor and get regular checkups, get free preventive care with an Affordable Care Act plan. They have a drug card, and that really has just been fabulous. It's been great to help people.
And what's that second example that you mentioned to me?
Well, so we have some examples that we wanted to share. Here we go. Dave is 25. He's a cook from Somerville, and he has a total household income of $13,000. So based on his income, a household of one, for a monthly premium of $14.06, he has a total maximum out of pocket of $500 and a primary care physician copay of only $5. Very comprehensive plan, and obviously a very affordable premium.
And that's important, Brett, because if you look, that maximum out of pocket, the number one reason people go into bankruptcy today is because of an expensive bill. They have a catastrophic event. They leave the hospital. They got a $30,000 bill that follows them around the rest of their life. All of these plans, not only the subsidies bring down your premiums, but they bring down your co-pays, your deductibles, and your maximum out of pocket. So they're very, very affordable.
Well, that's great to know. Thank you guys for being here. Again, we had Senator Joe Laurie with us this morning, and Chris Johnson, the Senior VP with Laurie Consulting. I want to give you their phone number. You can call them if you guys have any questions. As they said, 15, 20 minutes just to clarify anything. It's 803-256-2067. It's a free conversation. You can also go in person. And again, that deadline is this Sunday, February 15th. Make sure to stay with us. We'll be back in just a minute.